What if I told you that one simple technique in your morning shower, taking less than 2 minutes, could trigger immediate blood flow, restore morning hardness, and give you the kind of reliable function you thought was gone forever? And what if I told you this method is based on vascular science, costs absolutely nothing, and works even if medications have failed you? I'm Dr. Sophie Morgan, board certified urologist with over 15 years, specializing in men's sexual health and vascular restoration. I've treated over 4,500 men dealing with erectile dysfunction, and I can tell you this: what I'm about to reveal works when pills cause side effects, when you want immediate results without chemicals, and when you're tired of feeling like your body has betrayed you. In the next 15 minutes, I'm going to reveal exactly what this shower technique is, explain the precise vascular mechanism that makes it work instantly, give you the step-by-step protocol you can start tomorrow morning, and show you the 3 critical mistakes that make it completely ineffective. I'll share patient stories of men in their 70s who experienced immediate transformation and the optimization strategies that multiply the results. But here's the thing: most men try this once incorrectly, don't understand the timing or temperature sequence, see mediocre results, and give up, never realizing that precise technique makes all the difference between failure and dramatic success. So if you stay until the end, I'll give you the complete advanced protocol that ensures maximum benefit. Let me be brutally honest with you. The reason you're not waking up with morning hardness anymore isn't because your body is broken beyond repair. It's because nobody's shown you how to manually trigger the exact vascular response that creates spontaneous erections. Here's what's really happening. Morning erections aren't random. They're the result of parasympathetic nervous system activation during REM sleep, combined with nitric oxide release and increased blood flow to the pelvic region. When you're younger, this happens automatically and powerfully. But after 60, several things change that disrupt this natural process. Change 1. Your autonomic nervous system becomes less responsive. The signals that used to trigger automatic blood flow don't fire as strongly. Change 2. Your blood vessels have reduced elasticity and nitric oxide production, so even when signals are sent, the vascular response is weaker. Change 3. Chronic low-grade inflammation in your pelvic region restricts baseline blood flow, meaning you're starting from a deficit every morning. The result? You wake up with no hardness, no firmness, maybe nothing at all. And psychologically, this destroys your confidence because morning erections are a barometer of sexual health. When they disappear, you start believing everything is failing. But here's what I've learned treating thousands of men. You can manually trigger the exact same vascular response using targeted temperature contrast and mechanical stimulation. You can literally force your body to respond in the shower every single morning, creating immediate hardness that proves your system still works. This isn't about long-term healing, though that happens as a bonus. This is about immediate results. This morning, tomorrow morning, every morning. Think about what it would feel like to step out of the shower with 50, 60, even 70% hardness. Not from a pill, not from waiting weeks for supplements to work. From 2 minutes of technique that triggers instant vascular response. That confidence shift changes everything. How you feel about yourself, how you approach intimacy, how you move through your day. For those new here, I'm Dr. Sophie Morgan. I'm a board-certified urologist, and I've spent over 15 years specializing exclusively in men's sexual health, erectile dysfunction, and vascular medicine. I've treated over 4,500 men from their 30s to their 80s dealing with every degree of erectile dysfunction. My mission is simple. I'm tired of seeing men give up on their bodies because they think dysfunction is permanent. I'm tired of watching men become dependent on medications when simple vascular techniques can restore natural function. I've had patients restore immediate morning response using the exact protocol I'm sharing today. I've seen 70-year-old men step out of the shower with hardness they hadn't experienced in years. I've watched confidence return and relationships transform because one partner discovered this 2-minute technique. What makes this video different is this. Most doctors won't tell you about manual vascular techniques because they're trained to prescribe medications, not teach you how your body actually works. The technique I'm about to reveal is based on established vascular science. contrast hydrotherapy combined with targeted mechanical stimulation. It's been used in various forms for decades, but almost no one applies it specifically for erectile function. Now, if immediate results and natural function matter to you, hit that like button right now. Drop a comment telling me where you're watching from and whether you've lost your morning hardness. And subscribe so you never miss these videos on men's health and restoration. The technique is contrast hydrotherapy combined with targeted pelvic stimulation. Specifically, we're using alternating hot and cold water exposure on your pelvic region and genitals to trigger massive vasodilation and blood flow, followed by manual compression techniques that force blood into the erectile tissue. Here's why this works at the vascular level. When you expose tissue to cold water, your blood vessels constrict dramatically. This is called vasoconstriction. Your body pulls blood away from the surface to protect core temperature. Then, when you immediately switch to hot water, your body overcompensates with massive vasodilation. Your blood vessels expand wider than they were before the cold exposure. This is called reactive hyperemia. This hot-cold-hot sequence creates a vascular pumping effect. You're essentially forcing your blood vessels to contract and expand rapidly, which floods the tissue with oxygenated blood. For erectile tissue specifically, this sudden influx of blood, combined with the mechanical pressure of the water and targeted touch, triggers the exact same engorgement response that creates erections. A 2009 study published in the European Journal of Applied Physiology found that contrast water therapy increased blood flow to treated areas by up to 40%, and the effect lasted for 30 to 60 minutes after treatment. Another study from 2013 showed that alternating hot and cold exposure improved endothelial function, that's the health of your blood vessel linings, and enhanced nitric oxide bioavailability. But here's the critical part most men miss. The temperature contrast alone isn't enough. You need the correct sequence, the right duration for each temperature, and the targeted manual technique that directs that blood flow specifically into the erectile chambers. Without all three elements, you get minimal results. The shower synergy is this. You're already in the shower every morning. You're already naked. You have complete privacy. The warm environment relaxes your nervous system. Adding this 2-minute protocol to your existing routine requires zero extra time and creates immediate, measurable results. This isn't magic. This is vascular physiology, and it works. Here's the exact step-by-step protocol. Pay close attention to every detail because precision matters. Step 1. Start with your normal warm shower. Get your body temperature elevated and comfortable. This is your baseline. Approximately 2 to 3 minutes of normal warm water all over your body. You want your muscles relaxed and your nervous system calm. Step 2. Direct warm to hot water, as hot as you can comfortably tolerate without pain, directly onto your lower abdomen and pelvic region for 30 seconds. The target zone is from your navel down to your pubic bone and including your genitals. Let the hot water hit this entire area. You should feel significant warmth penetrating deep into the tissue. This creates initial vasodilation. Step 3. Immediately switch to cold water, as cold as your shower goes, directed at the exact same pelvic region for 15 to 20 seconds. This will be uncomfortable. Your body will want to move away. Don't. Keep the cold water flowing directly on your lower abdomen, pubic area, and genitals. You're creating maximum vasoconstriction. Your vessels are clamping down hard. Step 4. Immediately switch back to hot water on the same region for 45 to 60 seconds. This is the critical phase. The sudden return to heat after the cold shock creates reactive hyperemia. Your blood vessels dilate wider than they were initially. You should feel a rush of warmth and possibly tingling as blood floods the area. Step 5. While the hot water is still running, use your hand to apply firm, rhythmic pressure at the base of your penis and perineum. That's the area between your scrotum and anus. Use your palm or fingers to press and release in a pumping motion. 5 seconds of pressure, 2 seconds release. Repeat for the full 45 to 60 seconds that the hot water is running. This manual compression combined with the vasodilation forces blood into the erectile tissue. Step 6. One final cold water exposure for 10 to 15 seconds on the pelvic region. Then immediately turn off the water and step out. Do not continue your shower after this sequence. The technique is most effective when you end with the vascular response at its peak. The entire sequence from step 2 to step 6 takes approximately 2 minutes total. That's all. 2 minutes for immediate results. Most men will notice 50 to 70% tumescence. That's firmness and engorgement within 60 to 90 seconds of stepping out of the shower. It may not be full rigidity, but it's unmistakable blood flow and hardness that proves your system responds. Let me give you the 3 critical mistakes that destroy your results. Mistake 1. Using water that's not hot or cold enough. If your hot water is just warm, you won't create sufficient vasodilation. If your cold water is just cool, you won't create the contrast needed for reactive hyperemia. You need genuine hot as you can tolerate, and genuine cold as your shower produces. The temperature differential is what creates the vascular response. Mistake 2. Not keeping the water directed on the pelvic region long enough during each phase. Some men wave the water back and forth or only hit the area for 5 or 10 seconds. You need sustained exposure, 30 seconds of hot, 15 to 20 seconds of cold, 45 to 60 seconds of hot. Cutting these times short means insufficient vascular response. Mistake 3. Skipping the manual compression during step 5. The hot-cold contrast creates the blood flow, but the manual pressure during the final hot phase is what forces that blood specifically into the erectile chambers. Without the compression technique, you get general pelvic blood flow, but not targeted erectile engorgement. The combination is essential. Avoid these 3 errors and your results will be dramatic. Now let me show you how to optimize and amplify this technique. Optimization 1. Add deep belly breathing during the hot phases. When the hot water is running on your pelvic region, take slow, deep breaths. Inhale for 4 counts, exhale for 6 counts. This activates your parasympathetic nervous system, which enhances the erectile response. The combination of vascular stimulation plus nervous system activation is more powerful than either alone. Optimization 2. Before starting the contrast sequence, do 20 pelvic floor contractions. These are Kegels. Tighten like you're stopping urine midstream. Hold for 2 seconds. Release for 2 seconds. Repeat 20 times. This pre-activates the muscles that support erections and increases baseline blood flow to the region before you even start the hot-cold protocol. Optimization 3. After stepping out of the shower, immediately do 10 more strong Kegel contractions while you still have the engorgement. This trains your pelvic floor to maintain the blood flow and can extend the firmness from 90 seconds to 5 or even 10 minutes. Optimization 4. Use this technique specifically after you've taken L-citrulline or other nitric oxide supporting supplements. If you're already using the morning coffee plus L-citrulline protocol I teach, do that first, wait 20 minutes, then do this shower technique. The combination is exponentially more powerful because you have elevated nitric oxide levels that make your vessels hyper-responsive to the temperature contrast. What to combine this with? Cardiovascular exercise earlier in the morning or the night before. Exercise elevates baseline nitric oxide and improves endothelial function, making your vascular system more responsive to the shower technique. Adequate hydration. Drink 16 ounces of water when you wake up before your shower. Dehydration reduces blood volume and limits the engorgement response. What to avoid? Do not use this technique if you took a PDE5 inhibitor like Viagra or Cialis within the last 24 hours without medical clearance. The combination of medication plus aggressive vascular stimulation could cause priapism. Do not use this technique within 2 hours of vigorous exercise. Your body needs recovery time. Do not use excessively hot water if you have cardiovascular conditions, diabetes with neuropathy, or reduced temperature sensation. You could burn yourself without realizing it. Let me tell you about Thomas, 68 years old, retired firefighter. Thomas came to me devastated because he hadn't had a morning erection in over 3 years. He'd tried medications, tried supplements, tried everything. His wife was supportive, but he felt like he'd lost a fundamental part of his masculinity. I taught him this exact shower technique. He was skeptical. He said, "Doc, how is hot and cold water going to fix what Cialis couldn't?" But he tried it the very next morning. He followed the protocol exactly. 30 seconds hot, 20 seconds cold, 60 seconds hot with manual compression, 15 seconds cold, done. He called my office that same day. He was almost emotional on the phone. He said, "I stepped out of the shower and I had 50% hardness. 50%. I haven't seen that in the morning in 3 years. I just stood there staring at myself in the mirror." Thomas used this technique every single morning. By week 2, he was consistently getting 60 to 70% engorgement after the shower. By week 4, the morning firmness was starting to last longer, 5 to 8 minutes instead of 90 seconds. By week 8, he was occasionally waking up with natural morning erections before even doing the technique because his vascular system was healing from the daily stimulation. His wife confirmed that his confidence had returned, and that translated directly to their intimate life. The immediate feedback every morning, proof that his body could still respond, changed his entire psychology around sexual function. Then there's Michael, 73 years old, widowed and dating again. Michael was terrified about potential intimacy because he had zero spontaneous function. He started this shower protocol as a daily practice. Within 2 weeks, he had reliable post-shower engorgement every single morning. But the unexpected benefit was psychological. He told me, "Just knowing that I can create that response whenever I want gives me confidence. Even if it fades after 5 minutes, I've proven to myself that the equipment still works." That confidence translated directly to successful intimacy when the opportunity arose. The daily practice had trained his vascular system to respond, and when the moment came with his partner, his body knew what to do. Another patient, 65-year-old Robert, combined this technique with the L-citrulline protocol. He did 5 grams of L-citrulline in his morning coffee, waited 20 minutes, then did the shower technique. He reported that the combination created 80 to 90% rigidity that lasted for 15 to 20 minutes after the shower. He said it was like being 40 years old again. Let me give you the realistic timeline of what to expect. Day 1. Most men see 50 to 70% engorgement within 60 to 90 seconds of finishing the technique. It typically lasts 1 to 3 minutes. This immediate feedback proves your system can respond. Week 1. With daily practice, you'll notice the engorgement becomes more consistent and slightly firmer. You might hit 60 to 75% rigidity, and it may last 3 to 5 minutes. Your body is adapting to the daily vascular stimulus. Weeks 2 to 4. This is when many men start experiencing spontaneous morning erections on some days before they even do the technique. The daily contrast therapy is healing your endothelial function and training your vessels to respond more readily. Post-shower engorgement often reaches 70 to 80% and lasts 5 to 10 minutes, weeks 5 to 8. Function becomes more reliable and robust. Many men report that the firmness achieved in the shower is beginning to translate to partnered intimacy. Your body is relearning how to create and maintain blood flow. Some men can extend the engorgement to 15 or 20 minutes by using Kegel contractions and mental focus. Beyond 8 weeks, with continued daily practice, many men maintain improved baseline function throughout the day. The shower technique becomes a morning ritual that ensures you start every day with proof of function, and the cumulative vascular benefits support overall erectile health. If you stop the technique, the immediate benefits disappear within 2 to 3 days. But if you've been doing it for months, you'll likely retain some baseline improvement in spontaneous function for several weeks before gradually returning to your starting point. The key insight: this is both an immediate technique for daily results and a long-term practice that creates actual vascular healing. Now, I need to be completely clear about safety and contraindications. Do not use this technique if you have severe cardiovascular disease or uncontrolled high blood pressure. The temperature contrast creates significant cardiovascular stress, recent heart attack or stroke within the past 6 months, severe peripheral neuropathy where you can't accurately sense temperature, you could burn or freeze tissue without realizing it, active skin infections or open wounds in the pelvic area, Raynaud's disease or other conditions causing extreme sensitivity to cold. If you have any of these conditions, consult your physician before attempting contrast hydrotherapy. General safety guidelines. Never use water so hot it causes pain or redness that lasts more than a few seconds. Never use ice-cold water for more than 20 seconds at a time on your genitals. If you feel dizzy, lightheaded, or experience chest discomfort, stop immediately. If you develop prolonged erection lasting more than 2 hours after this technique, seek medical attention. Start conservatively if you're new to contrast therapy. Use moderate temperature differences for the first week, then gradually increase the contrast as your body adapts. Let's bring this all together, gentlemen. One technique: 2 minutes in the shower, every single morning. Hot water for 30 seconds on your pelvic region, cold water for 20 seconds. Hot water for 60 seconds with manual compression, cold water for 15 seconds. Done. Most men see immediate 50 to 70% engorgement within 90 seconds. This proves your body still works. This restores confidence. This creates a foundation for long-term vascular healing. The cost is zero. The time investment is 2 minutes. The results are immediate and measurable. Erase the belief that morning hardness is gone forever. Remove the shame around lost function. This is your body. This is your vascular system. You have every right to trigger it manually and prove it still responds. If this information gave you hope or taught you something new, smash that like button right now so more men can discover this technique. Subscribe if you're serious about immediate natural results. We're building a community of men taking control of their function. Drop a comment right now telling me, will you try this tomorrow morning? Have you lost your morning hardness? What's your biggest fear around erectile function? I read every comment. Share this with one friend who needs it. You could give him back his confidence with one 2-minute technique.